Good morning, everybody. Pleasingly, New South Wales had 143,000 people get vaccinated in the last 24-hour reporting period, a fantastic number, and keeping those vax rates high is so important. We currently have 6.4 million jabs in New South Wales. Nearly 62% of our population has had a first dose. I'll be super excited once 70% of our population gets their first dose, but even more excited knowing that 80% of our population has had their first dose, because once we hit 80% first dose, we have confidence that we'll hit that 80% second dose margin, and we'll be able to talk about the timeframes when we'll hit those targets. So please continue to come forward and get vaccinated. It's showing amazing success in terms of our vaccination rates and coverage, and we know how important that is moving forward. Last 24-hour period, we had 118,000 tests, which is increasingly a good number, and 882 cases of community transmission. 2 people lost their lives overnight, and we extend our condolences to their families, a male in their 60s, a male in their 90s, both with underlying health conditions and both with just 1 dose of the vaccine. 80% of our cases continue to be in Western and Southwestern Sydney at least. It's actually more than 80% are in those local government areas of concern. And we do today also want to call out people living in the local government area of Camden and people living in the balance or the rest of the local government area of Penrith. The health experts are telling us there are more cases there than they would like to see, and unless things improve there could be a chance that those areas could be designated local government areas of concern. But we're just asking everybody in Camden and the rest of the Penrith local government area just to be extra careful, just to continue to do the right thing, make sure you come forward and get vaccinated to ensure that you can continue the way you are in the foreseeable future. In the regions, far western New South Wales continues to be a challenge with stabilisation elsewhere in the regions, and the Deputy Premier will talk about that in his update. Very pleased today to also have the Minister for Education, Minister Mitchell, here with us today. The New South Wales Government has worked hard to have a safe way to get children back at school, and can I take this opportunity to thank parents, to thank the children and the students who've been homeschooling, and the teachers and the principals and all the school communities. We know what a difficult period of time this is, and every day I think about families who are struggling with home learning, working, and doing all those things during the lockdown to keep us going. And I just want to say how much we appreciate it. And can I also thank all the children who've been writing to me, talking to me about their experiences and sharing their stories. And I'm really grateful for that. Thank you very much. In relation to schools going back, the HSC exams will be pushed back till the 9th of November, and Minister Mitchell will talk about that. Pleasingly, there's already been discussion with the university sector, so no New South Wales students will be disadvantaged. It means the marking period and adjusting of scores won't happen till mid-January, but the university sector is appreciative of that and can accommodate that, which is good. Face-to-face learning will commence from October the 25th. It'll be staggered with kindy and year 1 starting, and then successively, progressively other years, and I'll ask Minister Mitchell to outline those details. We're also asking for everybody that works on a school campus, whether it's a teacher or school staff member, to be vaccinated by the November the 8th. Education has already done surveys and a large proportion of teachers are already vaccinated, but we are calling out for any teacher who's not vaccinated to get vaccinated, and we'll be supporting them and assisting them by having a special day for teachers on the 6th of September and a special week for teachers to make sure that any teachers or staff who will be going back to campus with school children are vaccinated at least before the 8th of November, but we're so pleased that there seems to be a high rate of vaccination amongst teachers already. Can I also stress that if there's any area of New South Wales which comes out of lockdown before October 25, that those children will automatically go back to school. So if health decides that any part of New South Wales is coming out of lockdown before the 25th of October date, well, that will obviously mean that schools can go back to face-to-face learning, as the regions had for a long time and as parts of Greater Sydney may have as well. So there are opportunities for school to go back earlier if that community is out of lockdown. Pleasingly, I note the federal government has announced that 12 to 15-year-olds will start having access to vaccines, and we assume that will be done in September, so that is also a pleasing development to give everybody that extra degree of comfort. And we're really looking forward to transitioning children back to face-to-face learning. We know what a difficult period of time this is, and we thank everybody, including all the community groups and stakeholders who've been working with education and health to ensure the safety of our students, teaching staff and parents during this difficult time. Dr. Gow will now give a health update, Deputy Premier will talk about the regions, and then Minister Mitchell will provide further detail around schools going back. Thank you.
Thank you very much, Premier, and good morning, everybody. There were 882 locally acquired cases of COVID-19 reported in the 24 hours till 8 p.m. last night, and there were also 3 overseas cases reported. Pleasingly, we had almost 120,000 people come forward for testing, which again is a really good number. And again, thank you to people for coming forward for testing. And just a reminder that we really want people to come forward for testing if that's a requirement for you and if you have symptoms, and to do so as early as possible. It's really important that those people that we really want to get tested are the ones coming forward for testing. So thank you, everybody, for your continued efforts in doing that. There are currently 767 COVID cases admitted to hospital, with 117 people in intensive care, and 47 of those people are requiring ventilation. Of the 117 people in ICU, the majority are not vaccinated, and that's 103 people not vaccinated. So again, a reminder to everybody about how important vaccination is in helping to prevent transmission, as well as in preventing severe effects of COVID, including ICU admission. Sadly, New South Wales Health has been notified of the deaths of 2 people who had COVID-19. As announced yesterday, there is a man in his 60s from Sydney's Nepean Blue Mountains district who sadly passed away at Nepean Hospital after he acquired his infection there earlier this month. And that gentleman was the 3rd death linked to the outbreak at the hospital. He had received 1 dose of a COVID vaccine, and also unfortunately had some serious underlying conditions. The second person who sadly passed away was a man in his 90s from Western Sydney, who died at Concord Hospital after he acquired his infection from Canterbury Hospital, and he's the 5th death linked to the outbreak at the Canterbury Hospital. He had received 1 dose of a COVID vaccine and also had some underlying conditions. And on behalf of New South Wales Health, my deepest sympathies to the families of those 2 gentlemen who have sadly passed away. As the Premier said, we continue to see a majority of cases emerging from the western and southwestern part of Sydney. And in particular, I'd like to ask the residents of the following suburbs to again pay extra vigilance to following the public health orders, to coming forward for testing, and to get vaccinated as soon as you can. And they are people who live in Marylands, in Guildford, in Auburn, Greenacre, Punchbowl, and also Condell Park. And finally, I'd like to call out to some of our regional areas where we have had sewage detected in recent days and where we are not currently aware of any cases. And they are people in Tamworth, Merimbula, Picton, and also Nyngan. So thank you very much.
Good morning. Can I start by offering my condolences to those families that lost loved ones? You remain in our thoughts and prayers. Overnight, in the Far West Local Health District, we had 9 cases. All 9 cases were in Wilcannia. In the Western New South Wales Local Health District, there were a total of 40 cases, 25 cases in Dubbo, 5 in Bourke, 4 in Orange, 4 in Narromine and 2 in Gadooga. In the Hunter, New England, only 2 cases overnight, 1 in the Port Stephens local government area and 1 in the Cessnock local government area. In the Illawarra Shoalhaven area, there were 5 cases overnight, 3 in the Wollongong local government area and 2 in the Shell Harbour local government area. And good news from the Central Coast, no cases. I do want to echo again concerns with sewage surveillance in Tamworth, Merimbula, Picton and Nyngan. So a call out to those communities to be vigilant if you have any symptoms to come out and get tested, as we have no known cases in those communities. And as always, I'd like to put a shout out to those communities in regional rural New South Wales that are getting vaccination. Shoalhaven local government area, they've got 60% single dose, 34% double dose. In the Port Macquarie local government area, 60% single dose, 33% double dose. Ballina, good numbers at 57 and 33. And to Burke, what a fantastic bit of movement there in under a week, from 36% single dose to 60%. Again, to everybody, the message is that we need to get vaccinated. A roadmap to freedom is attached to vaccination, and I encourage the regions to keep getting vaccinated. Thank you.
Well, good morning, everybody. As the Premier also said, I just want to start by thanking our thousands of teachers, our parents and our students during what has been a really challenging time. Learning from home is difficult. As a parent myself, I can attest to that. But each and every day I'm hearing wonderful stories about how our school communities right across New South Wales are supporting our students and our families to learn from home in the interests of their safety. I'm really pleased that today we are able to provide a clear roadmap to going back to the classroom. We know that the best teaching and learning happens in the classroom, but we also know it's really important for the social and emotional wellbeing of our students to be with their friends and to be back with their teachers. I want to thank all of the stakeholders who've contributed to our plan going forward. We've had some really positive discussions with them over the last few days, and I think everybody shares the view that this is a safe and a sensible approach to getting our students back to school, which is so important. So as the Premier said, we will be starting to see students return to the classroom from the 25th of October. It will be a staggered return. It's in line with how we expect to see increasing vaccination rates in our community, and we will also be having the strict COVID settings on our school site to make sure that we minimise risk to our students and our staff. As the Premier also said, if any communities come out of stay-at-home orders prior to that date, we will of course be able to see our students return to school. And again, that's in line with what we've done in other communities. If we're able to bring students back sooner in any LGAs, in any parts of the regions, of course we will do that. For the rest of Greater Sydney, of course, we end up with learning from home for the remainder of Term 3. Again, this is something that the Premier has outlined already this week. But from Term 4, from the 25th of October, our kindergarten and our Year 1 students will return to the classroom. We'll also allow for our Year 12 students to come back in a greater way than they are now. Obviously, at the moment, there's a limited return for Year 12 students. They can attend school for up to 2 hours a day. But from the 25th of October, we will be able to increase that. And that's particularly important to give those HSC students more time with their teachers face-to-face before their exams begin. From the 1st of November, we'll welcome back Year 2, Year 6 and Year 11, also crucial years, particularly those who are transitioning to high school and to their HSC work. And from 8th of November, all remaining year groups will be back in the classroom. As the Premier said, that is also the date when mandatory vaccinations will come into effect for our school staff. It's a key part of our plan. And we know that that's really important to protect our students. We've done a voluntary survey of our Department of Education staff over the last week. Pleasingly, we've had more than 50,000 staff respond to that, and that has given us an indication which shows that we have almost 70% of our workforce having already received 1 dose of the vaccination and close to 40% being double dosed already, which is really encouraging. We'll be making sure that we work with health to make sure our staff can access those vaccines. Again, as the Premier said, out at Kudos Bank Arena from the 6th of September, we'll have priority vaccinations for our school staff. We'll also open that to our early childhood education staff. And we know that this is important when it comes to protecting not just our workforce, but of course our students. When students do return to school, it will be on our Level 3 COVID restrictions. Again, these are settings that our school communities are used to. We've had them in place before. So what we will see are things like minimal mixing or mingling between students, not having extra adults on school sites, not having assemblies or large gatherings. We will also have mask wearing mandatory for all of our staff on our school sites, mandatory for our high school students, and we'll be strongly recommending that our primary school students also wear masks, and that's in line with the latest health advice. For our HSC students, can I say thank you so much for your patience and resilience. I think if we talk about any Year 12 cohort in recent times, you've certainly been through it. Your Year 11 was disrupted last year, and of course now you're learning from home in a really crucial period of your schooling. But it's really pleasing to be able to reassure you today that you will be able to do written exams, that you will be able to get an ATAR. If you want to go to university, you will be able to do that. And I think that should provide some comfort to our students who I know are finding it difficult during a time for them which is obviously stressful at the best of times, but equally challenging managing during a COVID setting. So NESA, who runs the HSC for all of the school sectors, has provided advice that we should delay the start of the exams until the 9th of November, as the Premier said. They will be releasing a new timetable in September, which will indicate to students when exams will be taking place. We anticipate that this means that the results will come out in mid-January, but again, the university sector have been consulted. They are able to accommodate those changes, and it does mean that any Year 12 student who wants to go to university will be able to be offered a place in line with previous years, and I think it's really important that our Year 12 students know that that is the case. So can I say, as Education Minister, I'm excited that we have a plan to have our students back in the classroom. I'm sure teachers would agree with that, and I'm sure parents, who I know many are doing their best during learning from home, but obviously it can be a bit of a challenge, should have some comfort knowing that we've got the plan going forward. We're excited to welcome our students back in a safe and a sensible way, and we look forward to that happening in October.
I think while most parents would welcome now the timeline, are you concerned that half the student population is going to have about 3 weeks of classroom teaching in 6 months? Because let's be honest, not much happens in December. So for those kids that go back November 8, that's going to be three or 4 weeks in 6 months of a year.
Right, so that'll be week 6 of an 11-week term. Look, obviously as Education Minister, can I say we don't make decisions to have students learning from home lightly. We know the best teaching and learning takes place in the classroom, but we've also got to balance that with the health advice and what we can do to keep our students and our staff safe. I think the key element now is that parents know the plan going forward. We continue with learning from home. There is an end date. There's light at the end of the tunnel for when students will be back, and that's important. But it's about getting that balance right between what's safe and what's sensible when it comes to the advice that we've got.
I understand that this plan says that students in any LGA could return to remote learning if the infectious number in the community passes 50 per 100,000. So based on that rule, which LGAs are the least likely to see their students return to school at this point?
So this is obviously the plan going forward for all of New South Wales, but what we will continue to do is rely on the health advice when it comes to specific local government areas. Again, that's not new. I'll draw your attention to, say, up in Armidale a few weeks ago, before regional New South Wales had lockdown restrictions. We had a positive case there. That entire LGA moved to learning from home. We have done this in other communities throughout the state as we've needed to. If we do have high case numbers in certain LGAs and the health advice is that we need to revert to learning from home in those areas, of course that's what we'll do as we manage throughout the pandemic. But what it does mean is that there won't be a blanket approach anymore. For schools that can be back safely, where there are low case numbers in the community, that will be able to occur, and I think that's the really important point.
Are there any LGAs right now that you are looking at, based on the case numbers that we're seeing today, are there any LGAs that pass that 50 per 100,000 figure and therefore will not go back to school under this?
Right, so obviously we need to look at that advice closer to the date. We're talking about a 25th of October return date. That's some 8 weeks away. We need to take that advice from health closer to the day. But again, I think this is about the public messaging around we all have to keep doing the right thing. We have to get vaccinated. We have to follow the stay-at-home orders, and the health advice will be given to us closer to that date in terms of any LGAs that may be affected. I can't preempt what that advice will be this far out.
Minister, if I could ask you about the vaccinations for teachers, which are now mandatory in November. ATAGI has just updated their advice. For 12-year-olds to 15-year-olds, they're now okay to get Pfizer. Are you going to change the plan to make it mandatory for students in that age group to get vaccinated with Pfizer before they return to school?
No, we won't. Obviously, we strongly encourage anyone who's eligible for a vaccine to take up that opportunity. At the moment, anyone over the age of 16 can get access to a vaccine. I'm really pleased that the federal government have announced that they're extending that to 12-year-olds. Anything we can do to protect our school communities is really important. We won't be mandating for our students, but we will be strongly encouraging anybody who is eligible to get vaccinated, and that now, of course, includes anyone aged 12 and up.
Teachers to be vaccinated by November 8th, but some schools in the regions could be returning after September 10. So can teachers in the region skip to the front of the queue? Many are still waiting another month for their first vaccine.
Yeah, so obviously the advice around what we can do in regional communities will be based on health. Clearly the risk in those communities will be lower if we are able to lift those stay-at-home orders. So it really is about looking at this in terms of that health matrix. Obviously anything that we can do to encourage our teachers and support them to get vaccinated, we will look at doing. I'm pleased, as I said, by those survey results that indicate almost 70% of our staff have had one jab already, which indicates they're booked in for their second dose already. I've had some colleagues get in touch with local GPs, local pharmacies who want to see what they can do to support our teachers to get vaccinated. We'll continue to explore all of those options, particularly in the regions. And, can I say, as someone who lives in regional New South Wales, there is ample supply of vaccines. Our community is having a vaxathon this weekend with our GPs and our pharmacists getting involved in Gunnedah, where I live. There are a lot of opportunities for people to get vaccinated. Teachers now know right across the state, but by the 8th of November, that will be mandatory. They have 10 weeks to ensure that they're vaccinated.
The Premier's
South West Sydney and Western Sydney, there's a lot of migrant families there. It's been really tough for parents across the board, but probably just or even more tough for parents there that don't have English as a first language, aren't as familiar with the Australian school curriculum and online learning tools. What will be done to give them support when they're sending their kids back to school and their kids have fallen behind during this lockdown period? What supports will they be offered to get their kids back up to speed? Yeah,
look, that's a great question. I've been having regular roundtables with principals from southwestern Sydney, and can I say I'm acutely aware of some of the challenges of families, particularly in that part of Sydney. I've had principals talk to me about some of the difficulties that families are facing, particularly when English isn't their first language or parents don't have strong literacy and numeracy skills, and the extra pressure that is putting on families. I think that's why our decision, particularly to bring kindergarten and Year 1 students first back, is important. Clearly those formative years are just essential. And think about it, if you're a student in kindergarten or Year 1, you have not had a year at school yet that hasn't been disrupted by learning from home. That's significant. And so I think part of our challenge will be not just to support our communities through this extended learning from home period until October 25th, but also look at what we can do when we return to school. We've had our $337 million COVID intensive support tuition program running this year. That's continuing online. That will continue throughout Term 4 for really targeted literacy and numeracy support for students who need it most. And I think as government, we also then need to look at what more we need to do into next year, not just in terms of education support, but I'm really conscious of wellbeing support for our families who have struggled as well. And they're all things that we'll continue to work on.
What other health measures will be in place? Can you give us an indication as to what schools are going to have to implement to keep our children safe?
Yeah, sure. So obviously, as I said before, we'll be returning to our level 3 COVID restriction settings. All our school principals are aware of that. That has been in place for some time. So in simple terms, what it will mean are things like staggering break times, not having mixing of year group cohorts, not having assemblies, band, choir, those sort of activities, again, where children might be gathering together. We won't have any external visitors to school sites. And the mask wearing, I think, is a really important element. So obviously, mandatory mask wearing for all of our staff on all of our school sites, mandatory mask wearing for all of our high school students, and for the first time we will also strongly encourage our primary school students to wear masks. We have supplies that we will make available to our schools so that they can do this. And again, I think this is about giving our parents and our staff comfort. We know that we're going to have that vaccination rate for our teachers as a mandatory vaccination. We know we're having controlled COVID-safe settings in our classrooms and on our school sites, and so they're the elements together that give us the confidence in this plan when it comes to a return to school.
About the option of cancelling HSC exams altogether?
So HSC exams will be going ahead. They will be starting on the 9th of November, as I said, and NESA will be providing an updated exam timetable in September for students so they can have that clarity.
Of concern. What about in those LGAs of concern where you say that if cases increase significantly, that learning from home will resume? What happens if Year 12s are in those LGAs of concern before the HSC?
Yeah, so as the Premier said, we have had a vaccine program for those Year 12 students already. They will be double vaccinated by the time those exams are scheduled, and indeed part of the consideration to delay those exams by a few weeks was to make sure that we had COVID-safe exam settings, and there was more confidence doing that from NESA from the 9th of November. We'll also make sure that any invigilators of those exams will also need to be vaccinated, again, in line with our requirements on school sites. And we will also have other measures in place. We've already started to seek advice from health around simple things like social distancing in those exam settings, looking at alternative venues. A lot of this work, again, was done by our school communities last year in preparation for a COVID-safe exam setting. So we feel confident with those rates going forward. The other point that I will make, the HSC has been running for many years. Every year there are illness and misadventure provisions. They were in place last year, they'll be in place this year. So if any particular student at the day of their exams is unable to attend because they're unwell, if they're impacted by being a COVID close contact, there are already procedures in place to help them as individuals in terms of the assessment of their results. If for whatever reason they need to miss their exam, that's not new. We've done that last year. We do it when there's bushfires or natural events, and there are really good mechanisms in place through NESA, who run the HSC, to accommodate for any of those issues on a school-by-school basis.
Minister, if there is an outbreak in a school, what is the plan then? We've seen outbreaks before. Does the school get shut down? If so, for how long?
Yeah, so we've got great measures in place when it comes to protecting and dealing with COVID cases in our school communities. Again, over the last 18 months, we've had a number of schools that have been impacted by positive cases with either our teachers or students or members of school families. So what happens if there is a positive case in a school is that obviously we close that school. We work with health to do the relevant contact tracing, make sure that those who need to isolate do so. There is a deep clean conducted on those schools, and then they're reopened when they're safe to do so. We've been doing this since last year. We've done it throughout the course of the pandemic, and we'll continue to do that while we're living with COVID-19.
Does it mean that the marking will go over Christmas, that teachers would actually work through their holidays?
Yeah, so obviously what this does mean is that, yes, the time period for the marking of those examinations will also be pushed back. That's why we're looking at a January 15 or midway through January as the expected date for results. But again, NESA will confirm that exact date in the coming weeks. But, we've had conversations with our teachers and our school communities about this. The HSC is a really important end to 13 years of schooling, and I think everybody shares the view that we have to do what we can to support our students so that they can do their written exams, so that they can be marked. Obviously, our universities have been incredibly accommodating to be able to push back to that January release date for exams. So, we're all supporting the Year 12 students to be able to get their HSC. It's important, and we feel confident that we will be able to have the markers that we need and to get this process done, albeit slightly later than we would have normally done it.
Can you confirm if it will be all subjects? We've heard it may be just a handful, maybe only English, and whether there'll be some sat outside.
So obviously those are decisions that the NESA COVID committee will make and provide advice to government shortly. That COVID committee, I should say, is made up of representatives of all three school sectors and also teachers and principals. Look, as Education Minister, I want as many students as possible to be able to show us what they know through their written examinations, but I await that advice from NESA in terms of what that new timetable will look like and further details which are to come.
Parents of children aged 12 and over are booking vaccinations right now through the New South Wales vaccination page. Are bookings officially open for this age group this morning, and if not, will bookings already made this weekend and beyond be honoured?
Do you want to answer that one, Premier? Yeah.
Certainly, any bookings that are made successfully, of course, are honoured. We're pleased now there's a national strategy for 12 to 15-year-olds, and we encourage parents who are inclined to make those bookings to do so. And of course, what we would also love when it's available is more vaccine, because obviously children under 18 only get the Pfizer vaccine. So clearly we're planning to accommodate those students, and I understand mid-September is when we expect most parents to be able to make those bookings in earnest in a reasonable time frame.
Explain a little bit.
Obviously, there's a lot of vaccine hesitancy amongst parents for their children to get vaccinated. We're aware of families where some kids under 18 want to get vaccinated, but the parents are saying no. What's your advice?
Look, obviously, we'd love to see the vaccination rates as high as possible, even amongst eligible children, and that's a matter for the parents. We've already encouraged people between the ages of 16 and 18 to come forward and get the Pfizer vaccine. In those 12 local government areas of concern, just to recap, we had that week blitz where we had nearly 16,000 16 to 18-year-olds get the vaccine amongst a high school cohort, year 12 cohort of 19 to 20,000. So that was a really good response. So we know at least in those areas of most concern, the vast majority of HSC students are already on their way to full vaccination. Look, we would never tell parents what to do, but obviously the safety of their children is a matter for them, and we'll have more health advice to provide in relation to those issues. In relation to adolescents 16 years and over, I think there's no question that we encourage them to get their hands on a vaccine and get vaccinated, and clearly we're always welcoming from the federal government any additional doses of the Pfizer vaccine to support our adolescents and young adults in getting vaccinated.
If you hit the 80% target earlier than expected and given the pace that's possible, could you bring this whole timetable forward a few weeks?
Look, there is that potential, but what we need to do is give parents the absolute certainty as to when things will happen, and we've done it in a very cautious, planned way. Consultation, incorporating the health advice, incorporating where we think vaccine levels are at. As I said, we're about 62% first doses in New South Wales of the vaccine. I'll get really excited when we hit 70% first dose, but super excited when we hit 80% first dose, because that will tell us when we're likely to hit double dose 80%, but it will also tell us we're going to hit that target. Many countries around the world, many states around the world still haven't reached 80% double dose, even though they started their vaccination programs way before we did. So once we get to 80% first dose, we'll have enormous confidence that we're going to hit those targets and also when we're going to hit those targets. But irrespective of that, we're confident that the vaccination rates will be much higher than what they are now by that time. The extra measures we're putting into schools, the fact that teachers will all be vaccinated, the fact that many 16-plus-year-olds will be vaccinated, plus it's a staggered return. You won't have huge campuses with children there at the one time, all the time. So it is a very planned way moving forward, and I'm just hopeful that this brings joy to many children and parents who are really doing it tough. And we know there's still a bit more time to wait, but we're also confident this will give people that hope that things will regain to some level of normality sooner rather than later, and especially confidence for Year 12 students that they'll attain the qualifications they need to pursue whatever the dream they want to pursue, whether it's further education, getting into the workforce, getting their credentials. It's a really important milestone in anybody's life, and we want to make sure we provide that certainty.
Please explain the health advice.
You said that vaccines won't be mandatory for the students to return. But are you looking at some kind of in-school vaccine program for once they can return to make it easier?
Yeah, we are considering all those opportunities. Once we have additional access to vaccine, which we understand will happen in around mid-September, once we have additional access to vaccine, we are considering how you might be able to do vaccinations within school communities, within family communities. In parts of Western and Southwestern Sydney, we already have some plans in place for family vaccinations. So we are looking at those opportunities, and I think the Prime Minister just stood up before I did at this press conference and made some announcements around mid-September being when we're likely to see more vaccines available to 12 to 15-year-olds. So that's clearly a time in which we'll put some of those plans in action. But we have already started thinking about in-school vaccination programs, which is the best way to get to those cohorts. And we ask parents to start considering what options they would like for their children in relation to vaccines. Clearly, 16 and over, we strongly recommend, given we know that older adolescents are more susceptible to the disease. But we've also seen very low rates, and I want to stress this from a medical perspective, very low rates of serious illness in younger children. It's quite uncommon to see very serious rates of illness in younger children. So we've based our return to school based on all that information that we have.
Dr. Gill.
I'm sorry?
How important is it to have National Cabinet united on this moving forward?
Look, I'd love to see National Cabinet continue to be united on backing the Doherty plan. We all signed up for it. We all said we support it. And obviously every single state is at a different stage of their COVID journey. New South Wales, in a confronting way, had to face that COVID journey earlier than others. But every state is going to have to come to terms with living with COVID. And even if you start off with 0 or very low case numbers, eventually those case numbers will rise, because that's the way Delta works. But so long as you have high rates of vaccination, COVID safety plans in place, good information to the community on what they need to do to stay protected, we can show the rest of the world how we can have a managed way of life back to normality without seeing those high rates of hospitalisation that we've seen in other parts of the world if we do it in a managed way. And I'm so confident we will do that in New South Wales. It has been a hard time. It's been a very confronting time to change the way we think about COVID. We've been used to having 0 or small number of cases for a long time, and now we're having to confront what living with COVID is like. But the one pleasing thing, and I don't, again, want to be taken out of context in making this comment, is even though we've had high case numbers, the rate of hospitalisation has still been relatively low, and the mortality rate has been relatively low compared to other outbreaks in Australia. So that gives us heart that our strategy is definitely working, that our strategy in being safe, in opening up at the right time, will also be managed well. And we also have confidence that even though the public are very frustrated and at times very angry in some of the decisions we've had to take, the public is really responding, and thank you to all of you who are responding to getting vaccinated, doing the right thing and really coming on the journey together, because we will show the rest of Australia what it's like to have case numbers, because even if you open up with 20 cases or 30 cases or 0 cases, Delta is going to creep in and Delta cases will increase as the rate of freedom increases. And that's why it's really important for all of us to come to terms with that. The Doherty report actually says once you hit 70% double dose, you don't even need to focus on the number of cases so much, but really the rates of hospitalisation. And we're starting to make that mind shift or mind change in New South Wales. It's really the most important figure for us is 2 things at the moment. What is the vaccination rate and how many people are we keeping out of hospital? And they're the 2 things that really matter the most, and they're the 2 things that will matter even when we start to live life more freely at 70% and then obviously at 80%.
I understand it at Education Estimates just now. They've confirmed that students won't go back to school if they live in LGAs that remain as hotspots. Can you confirm that?
Well, look, as the Education Minister said, we have to await closer to that time what the situation is before we make any definite statements. It would be unfair to families and unfair to communities to make definitive statements when October 25 is still some time away in the COVID world. So I just ask everybody for their patience. Please know the return to school will be safe. We don't want to see any students disadvantaged, and that's why some weeks ago we took the important decision to vaccinate all of our Year 12 students in those areas of concern to make sure that, notwithstanding what was happening, they sit their exams as every other child does, every other student does across the state, that they're in a position to sit their exams safely, having that extra protection, and we'll keep the community advised along the way. But it's way too early to make any definitive statement as to what that means for those areas of concern.
Reopening, for example, over the next few months, for example, hair salons, beauty salons. Can you confirm those reports?
Oh, well, look, I will confirm that the government has already started working on industry plans to make sure we start reopening at 70% double dose. We've made those plans very clear. It will be a very staged, very safe way to go back, but we're asking industry to work with us, and it's no secret we've been on that journey. And when we're in a position to provide a bit more detail around what life will look like at 70% double dose, we will obviously do that. But in the meantime, it's really important for us not just to have those high rates of vaccination across the state, but especially in those local government areas of concern. Obviously, when we hit 70% double dose, we would like to see less cases. I mean, that would be preferential, because then it means you're less likely to have a jump in cases once you do 70% double dose. So there's no doubt, can I make it perfectly clear, at 70% double dose, all of us will have more freedom. All of us will be able to live more safely and more freely with COVID. But the extent of those freedoms will depend on what else is happening around New South Wales, and will depend on what's happening, especially in those local government areas of concern. And that's why we really need to make sure that everybody in those 12 local government areas, the suburbs in Western and Southwestern Sydney that we've spoken about, has access to vaccine, is encouraged to get vaccinated, because not only will that save the lives of many in their community and save the lives of their loved ones, but it will also help stop stop the spread as fast, and that's exactly where we need to be. Dr. Gale, would you like to ask?
Could you just on hospitals, could you confirm the size of the cluster at Canterbury Hospital now? And also at Westmead, we're hearing that they're now using ventilators in non-ICU wards. They're quite overwhelmed. Can you give us some comments on that?
Sure. Let me just find the numbers for you for Canterbury, which I don't have the detail here exactly, but I'd be happy to provide that in terms of the outbreak at Canterbury Hospital. And in terms of Westmead, so again, I don't have the detail about that provision of ICU care outside, but what I do know is across the state, you know, our ICU network is very well connected. There is a lot of capacity across the state in terms of ICU beds. And our services are well equipped to care for anybody who may need those services. And there's other facilities there to assist Westmead, and I understand that with the cases in Western Sydney, you know, they have been under stress. But we have a very skilled, highly competent ICU team, and I know that there has been a lot of preparedness work done in maintaining that ICU capacity. And certainly services in other parts of Sydney and other parts of the state will be there to assist to make sure that any person who needs ICU care can have access to that.
We've got now upwards of 800 cases a day. We've spoken to people who are waiting days after testing positive to have any contact with New South Wales Health to advise them on what to do with their living situation, with their care. Are there now just too many cases for you guys to provide that support in a timely manner? Like, what is the protocol there?
Yeah, thank you for that question. I mean, clearly the growth in cases has been a challenge, and it has been a stress on our services, both for the teams who conduct the contact tracing, to contact cases, to call them, and for our clinical teams. But there are a lot of people working extremely hard. And across all of those activities, we continue to recruit and train and surge those teams to be able to meet the demand. Some of the changes we have made as well in recent days and from last week is now that whenever somebody tests positive to COVID-19, they receive an automated text message that advises them of that result, that reminds them of the need to stay in isolation, that tells them to contact their household contacts, gives them information, and gives them a number as well to call if they need assistance, and also tells them that they will be linked in and got in touch with by the clinical teams who will be following them up. And in addition to that, we know that our colleagues in police visit people who have been diagnosed with COVID-19, as well as close contacts, to check they're in isolation and also to support their welfare. So for people who might need food, who might need accommodation issues, who might need access to financial supports. So across all agencies from different parts of health and as well as police, everybody is working extremely hard to make sure that we reach people, let them know that they're positive, let them know what services are available to them, link them in with clinical care and make sure that their basic needs are met. And I would also like to say for anyone who is diagnosed with COVID-19, and if you are concerned about your health, you can reach out to the clinical team caring for you, you can contact your GP, you can contact Health Direct. And if you have concerns that you have any symptoms that indicate a medical emergency, please do call 000. We know that our ambulance service is a precious resource and is there for medical emergencies. And I'd like to also remind the community more generally that our ambulance service is there for medical emergencies, and please at this time they need to focus their response, including for people who have COVID-19.
From a health perspective, how relieved was health that the police finally caught up with that fugitive COVID patient Anthony Duran yesterday?
Look, we're always concerned about any reports of people who might not be following the public health advice, but we know that the vast majority of people in the community do follow that advice. We know the vast majority of people diagnosed with COVID-19 do the right thing. The vast majority of people who are close contacts do the right thing. And we recognise that it is difficult for families to be in isolation, often when they're feeling unwell, when other family members are feeling unwell, but the vast majority of people are doing the right thing. And I'd like to say a big thank you to the people in the community who have become unwell with COVID-19 or who are close contacts for the wonderful job that you do in following the advice, staying at home, keeping the community safe.
Specifically on that, sorry, Dr. Health was obviously very worried about it.
Yeah.
So it must be a huge relief that he's now been caught up with that.
Well, yes, absolutely. I mean, we remain concerned about anybody where there are reports if they don't follow the health advice. And so we're just pleased when there is no longer a risk to the community.
I know much has been made of the capacity to expand up to 2,000 beds, but if I could just ask you on staff specifically, are you really confident that if we do have to get 2,000 people in ICU in the state, that there'll be enough skilled staff and that the delivery of care won't be compromised if staff from other units who aren't trained in ICU have to come in?
Thank you. We're very lucky in the New South Wales health system to have a very well-connected, well-resourced ICU sector, and there has been a lot of preparedness work that has happened since the beginning of the pandemic in March last year across all hospitals across the state to prepare for the need if we did need to provide care for more people in ICU. And that includes, standardised guidelines, training for people, upskilling other nurses who maybe have experience in ICU but haven't worked there for some time, looking at theatre staff who also have important skills relevant for ICU, ED staff who also have critical care skills. So there's been a lot of work across our system since the beginning of the pandemic to make sure that our workforce is well equipped, well trained, well up to date. So I have great confidence in my clinical colleagues that they're very well up to the task.
Premier,
what will happen to any teachers that refuse to have the vaccine? Will they lose their jobs? What will happen to them?
Look, obviously we're working through those issues, but many nations around the world have mandated, and many states, even in the United States, have mandated for their teachers to be fully vaccinated. So their issues and challenges we'll work through, but I'm so encouraged by the survey response which Minister Mitchell spoke about, where already 70% of our teaching force have had at least one dose. So that's really, really encouraging, and I encourage all teachers, all staff, not just teachers, but obviously admin staff and support staff and anybody who supports a school community who has to be on campus with the children to be vaccinated. And obviously teachers are doing it tough. Teachers have enormous responsibility, but I think everybody appreciates that when you're in daily contact with children, what is more important than protecting our children in every which way? And so we just encourage everybody to do that. And we know that teachers are a special class of people. They are inspiring and teaching the next generation, and I think everybody appreciates the importance of protecting children first and foremost during this time.
Why is it that the far north coast is still in lockdown, given there's no cases up there, as well as some other parts of the state? And what's being done to create a border bubble with Queensland there?
Well, look, obviously we have extended the lockdown in the regions till midnight, September the 10th. As a precaution, there are parts of regional New South Wales that have never had a case and don't have a case now, but there's also been sewage detection in some of those communities, whether it's in the Northern Rivers or whether it's in the Mid-North Coast or the Riverina and elsewhere. And given what is happening in other parts of regional New South Wales, and also what is happening in Victoria, in regional Victoria at the moment, I don't think anybody would begrudge us for being overly cautious. And I guess no matter what decision we make, we're criticised. We were criticised previously of not locking down all of regional New South Wales, and now I'm getting questions about why we've done that. But as you appreciate, all of our decisions are based on the health advice. They're precautionary to make sure that we don't have outbreaks, and there is a potential for regional New South Wales to remain relatively parts of regional New South Wales to remain relatively virus-free. And those those communities which have had larger outbreaks, and one great example is Hunter, New England, where they were having 20-something cases a day, are now down to 1 or 2 a day, is a great result. And if we can keep that up in other communities and really keep the case numbers low, and of course, Dubbo and Western New South Wales remains our absolute concern, and there's intensive activity in those communities to make sure the virus doesn't get out of control. So this is a precaution. We just ask everybody to be patient. There are also, please remember, vast swaths of Greater Sydney which haven't had any. There are some local government areas in Greater Sydney that haven't had cases that have done very well, that have got high vaccination rates. So we're asking everybody to be patient at this time, and we know that we'll get criticised no matter what we do, but what is important to do is what is right for the community. And as I say, blame me, but at the end of the day, every decision we take is to keep people safe and to put us in as strong as position as possible once we hit the 70% double dose. We also have to be mindful that the density in regional New South Wales is different, access to hospitals is very different. So there's a number of things you need to consider. But all in all, I believe the approach we've had to date has been balanced, and whilst some people are very frustrated, some more than others, it is because of the greater good, and during a pandemic all of us have to forego our liberty and what we enjoy doing to keep everybody safe, and that's exactly what we're asking all of our communities to do.
Can you give us an idea about public transport?
We've spoken to families who are literally separated by that border. Obviously some people work over the border, they then can't go back and see their families, they're meeting up at the border just to catch a glimpse of them. Is there any plan in the near future to give them some relief up there?
Well, look, I hope the Queensland Government can think about that. I mean, that's their decision, but as has been highlighted, the Northern Rivers, the northern border communities in New South Wales have not had, I don't think, any cases of COVID for a long time. They're really decisions for the Queensland Government. Pleasingly, we've worked well with our Victorian Government in terms of all the checkpoints down there, but obviously if the Queensland Government can consider the virus risk and the ability of people in those communities who live as one community to come in and out safely is a matter for the Queensland Government, and all I can do is encourage them to look favourably on those people doing it tough, and also look at the existence or otherwise of any cases up there.
Public transport from the 25th of October. If I could just ask about
leaders that are concerned about hospitals there not having enough capacity in the ICUs. Yesterday, Mr Hazard said that if there were any problems, it would be helpful to transfer them here into the major metropolitan hospitals. Given the pressure that we're under now, do you think we'd have capacity to help those people?
Yeah, can I just make this point? And I know Dr Gale and Minister Hazard and Dr Chan have answered these questions earlier in the week. But we have been ready for additional ICU patients for a long time. We had always those contingency plans in place. But what is confronting for all of us is when you have a network that has great staff, that is seeing more patients, it does stretch things, and it does mean things are done differently. So we can't do things the same as you would if there wasn't a pandemic. A pandemic is a health crisis, is a health situation where things have to be done differently, and that's why we have a network of amazing specialists, nurses. Can I thank the nurses? The nurses are the ones that are holding patients' hands, helping them through those difficult times when relatives can't. I just want to do a special call out to nurses, but we have an amazing network of specialists, of staff, of bed capacity, but obviously some hospitals are under much more pressure than others because of the nature of the virus and where it's concentrated. But also, can I give a shout out to all the paramedics? I mean, it does mean doing things differently. So please judge the system and its ability to cope based on what you'd expect in a pandemic, not what you'd expect under normal circumstances. So there are also extra provisions that have to be taken in place. So, for example, an ambulance might need to wait a bit longer to make sure that when the COVID patient is taken through the ward, it doesn't infect other staff or other patients. So there's a whole range of procedures that kick in during a pandemic. And so I just ask everybody, firstly, to feel assured that our system has been practising is the wrong word, but preparing for this surge for a long time, that we have capable staff. Are they under pressure? Are they stressed? Is this the most challenging time in their lives? Absolutely. But it's the most challenging time in all of our lives. And the best thing we can do to help our staff, our hospitals and the patients is to get vaccinated. Last question.
To the public transport network to prepare for students going back. What's been done to make the public transport system safe for them to return?
Well, obviously, all those things, all those measures will start to kick in place. But if parents are able to walk their children to school, obviously that's the safest method. Obviously drive. There's all these options that parents can consider about safe transport to and from school. We'll have more to say about that as we approach the October 25 date. But we've been through this before. Many schools have had to go through the disruption of being closed or opening up when there's been an outbreak of cases. So it's not new for all of us, as home learning, unfortunately, wasn't new to many communities. So we have time to make sure we make all those preparations, and we'll have a better idea of where things are at by that stage as well. Thank you, everybody. Last question there. One more to the DP, and then we'll see.
A longer-term vision, actually. But you spend a lot of money upgrading some of those major hospitals in the southwest. I think a lot of people on the ground at the moment feel like there should actually be more hospitals in that area, perhaps around the new airport. It's such a booming population, potential for further pandemics or health crises to come. To look at new hospitals, again, I appreciate it's a longer-term.
Yeah, of course, around the new Aerotropolis, the new city around the airport, we're absolutely looking at that. But it just goes to show that when you have increased investment in hospitals over time, it does prepare you for these situations. So I don't think there's a hospital in Western or Southwestern Sydney that hasn't received an upgrade in the last 10 years. We're building new hospitals as we speak. We're really investing in our staff and bringing extra staff on board as well. And thank you to all of you, all the staff who are not only using their existing training, but many are getting trained up to do jobs that perhaps they're a bit different to what they're used to doing. So it's really encouraging to know that our investment in public health year on year has put us in the strongest position possible. And whilst we do anticipate extra patients in ICU as time goes on, we're ready for it. We have 2,000 ventilators. I don't anticipate we'll be using them, but it's still important for the community to know that all of those things are there. And if we do need to do things a bit differently, that's okay, because we're in a pandemic. Those plans are designed to kick in during a pandemic. Would they be things you'd do if there wasn't a pandemic? No. But in a pandemic, if you have to increase the size of a ward or you need to move patients around within a region, they are things that you would do in a pandemic, which is which is practice that you've planned for. So whilst we appreciate the enormous stress on our system, the system is designed to cope, but it does mean things might happen a bit differently because we're in a pandemic, and that obviously puts extra pressure on the system. The DP has one question, I think, and then we'll wrap it up for today. Thank you.
Communities who are begging to have some of their businesses open, some of their economy ticking over until they get a case. Are you against that? Do you fear that once you get a case in a regional community, the horse is bolted?
The worst thing you can do in a community is to give them false hope. By opening it and then a couple of days later shut them down again. And if you're a business and you're in hospitality, a cafe, a restaurant, you're preparing food, that's the worst scenario. What we can't do is just have this very small community by community approach, because we know we're an integrated community in the regions. We've locked down for a further 2 weeks to give us confidence in the data through our sewage surveillance, our network of contact tracers, finding out where we've got new cases. But the reality is, as of this morning, we continue to have high numbers of cases in the Central West and in the Far West. We continue to have cases, even though low numbers, in the Hunter, in the Illawarra. We still have cases growing in Canberra and I'm not blaming Canberra, but it causes a risk for that region, and we've seen already seepage into Queanbeyan and Goulburn. We've got surveillance in Cooma and Merimbula in relation to sewage surveillance. We've got the issue in regional Victoria, where in places like Shepparton, numbers are high, and therefore there's a threat to the Riverina. So it's very easy to say, let's open it part, but no part in regional or community in regional New South Wales is an island. And so what we'll do is look at a regional approach. If there's an opportunity in 2 weeks' time to look at a broader region where we know we're confident with health advice that we could open, of course we'll give consideration to that. But businesses are doing it tough. We get that. There is, of course, the JobSaver payments. There are support for those businesses. And just again, as the Premier touched on, in regional rural New South Wales, we've been locked down for 2 weeks. Some communities probably 3 or 4. But here in Sydney, it's on 10 weeks, and it is pain. It's a burden on everybody. But if we can just stick to the rules, if we take a precautionary approach to the bush, then we're not going to have some of the issues that we've seen here in an elongated lockdown in Sydney. So right now, I say sorry. But right now, we need to stick it out at least for the next 2 weeks. Thank you.